And there is local reaction to the budget bill, which is set to knock tens of thousands of Arkansans off Medicaid if approved.
Some healthcare workers here in the state are pushing back on the bill, and THV 11's Tamer Knight is here to show us how it could impact hospitals and patients statewide. Good morning, Tamer.
Well, good morning, Karen and Hayden. If the president's so-called big, beautiful bill passes the House, hospitals in Arkansas could be forced to make some big, tough cuts. Health advocates say the proposed Medicaid changes would cost jobs and access to health care. The bill will extend the president's 2017 tax cuts and eliminate taxes on tips and overtime. But to counteract the costs, it calls for deep cuts to Medicaid. That includes new work requirements and a freeze on provider taxes, which helps many small hospitals stay afloat. Neil Reeves with the Arkansas Nurses Association just recently spent time in Washington lobbying against the plan.
So roughly a third of our state is on Medicaid and stand to potentially be affected by any kind of cuts. And some of the cuts could be something as simple as they're putting a pause on some of the provider taxes, meaning there's no increase. We may see providers shut their doors. We may see hospitals shut their doors because financially they just can no longer survive.
Now, more than 800,000 Arkansans are currently on Medicaid. Reeves says the new 6 months recertification rule could leave many without coverage. The ripple effect: fewer staff, more job losses, and reduced services, with concerns for those in rural communities. Now, again, the bill is up for a final vote in the House later today, and many healthcare workers in Arkansas will be watching it very closely. But for now, Tamer Knight, THV 11 News.
And it will certainly become law not too long from now. All right, Tamer, thank you.